how would you improve Canada's healthcare system?
I think we could do something about the doctor shortage. I mean, certainly have one of those in Quebec at least. I know they make it very difficult to become a doctor. If you come from abroad, for instance, they'll make you go to medical school again, even if you're already trained. So they could do something about that.
I say more has to go into it, more healthcare workers, more people taking their time to work, but also giving people the rest they need. But I mean, it all goes through who they allow working, because it's all who they allow to work. You know, I feel like they need better service for the people.
I think the biggest issue with our healthcare system is like the lack of attentiveness to patients in like the multitude of their needs. I think that people oftentimes feel like they don't have the space or the time when accessing healthcare to address what they actually want to address. And I think mainly what I'm thinking about is like psychological and mental health issues. I think that's something that people still don't have proper access to. And yeah, there isn't space in healthcare spaces to address those problems.
I would encourage people to get an education in the health and to stay in Canada rather than go to other places, so we can have more staff and just have more. I've been to hospitals during COVID for vaccines, and I saw that most of them are run down. And I think this is very important to modernize the hospitals and make it a good environment for both staff and patients, and make it more attractive for people to go into that field.
That's really tough, but I definitely do think that nurses, doctors need better pays, they need better conditions. They killed themselves over the last period of COVID and everything, and their jobs are really hard. So I really think that it needs to be more financed, because you cannot really ask them to work that many extra hours and everything for such little like rewards.
More doctors and nurses being trained, because I think that, you know, there's people that have just left the profession, and I also like to see foreign doctors that it may be made a bit easier for them to practice in Canada. You know, with the not starting from square one, but some kind of compacted retraining.
Well, I'm a healthcare worker, so I don't know, that's kind of hard to say. Definitely the wait times are excessive, and I think there's not enough funding for new doctors and new nurses coming in. So maybe if Canada would stop implementing new plans outside of healthcare and focus on that, where all of the stress is, that would be probably more beneficial to people like myself and to nurses that I work with who are, you know, exhausted and overworked and burnt out.
That's tough, because it's I guess if we can have a push to have more people interested in healthcare and wanting to get into nursing, get into just healthcare in general.
I think our medical system is doing not fairly well under the circumstances.
Like, I've been waiting for an operation. They're telling me it's going to be at least 3 years before I can get the operation. So, you know, the waiting times are horrific. I know my sister's waiting for some tests, and it's been months and delayed, mainly because of the COVID. So it's hard to tell right now with the COVID going on, but normally, in a normal time, I think they got to get their response times a little bit faster.
Well, I just moved to Quebec from 51 years here, and I find that to get into a clinic, it's almost impossible. You have to go through the emergency, which works perfectly, but it's very expensive that way. So I used to have better, easier service in Ontario, but maybe it's the adaptation. I don't know.
I think we have to sit down provincially, and that we have to see what's actually the problems. I think there is a lack of manpower in hospitals or different sectors of the health sector. So we need to see what we can do to encourage people to join the healthcare system and improve the work, maybe the salary also. So they're happy to work there, you know.
I would allow private care as well, two-tier system. I think because it's strictly public, I don't think there's sufficient money to care for all of the needs, health needs, and I think at some point we have to pay more.
Funding for people who are disadvantaged, so people have access to our healthcare system. They can show up, they can receive treatment for their physical health issues or their mental health issues. But then what happens if you attend an acute care facility and you're stabilized from an acute care perspective, and then you need to transition to the community? We lack resources.
To be more accessible, I guess, for everyone. I feel like coming from Europe, everything is faster, more accessible. So there's more, I guess, equity as well. And that's the main difference, I guess. It's more expensive, it's less accessible. So yeah, there is a lot to do on this case.
Well, we need more efficiency. We have to reduce the wait times. They're terrible now, especially with COVID, because COVID is taking up so much of our space in hospitals. And we're going to have to do it some way, either through efficiencies or through a private-public system like many countries have around the world. You can still provide care for the people who don't have the means to pay for it, but there's lots of people who have the means that are willing to contribute. And I think we need to look at that, whether it's through an insurance scheme or some other way.